Thank you for watching this video. Please subscribe to my YouTube channel and follow my Facebook page. Please also support my work on Patreon and Kickstarter. It will be greatly appreciated. Okay, so I will pull my checklist up also because sometimes I forget myself what I have to do. And the checklist is right here, heart and major vessels. And so it starts with on the heart, left and okay, let's do the heart first. Okay, so first of all, transverse section of the thorax. Now that should be fairly clear. You can sort of see vertebra here. That's what the lungs looks like. And you've got the rib cage around here. So let me take you all the way superiorly. If you have any questions, any concerns, come straight away and ask. And if you've got your mouse unmuted, please do mute it. I know I can do it too from here. Mute all. There you go. I think I'm hearing my mic too much. Okay, so let's start from here. So this is, I'm taking you very superiorly. And even though we'll do bones on a different session, I want to show you this bone. And this is the clavicle that's attaching to the sternum there. So that's the clavicle. And this is the first rib over here. And so that's the first rib that's crossing over there. So that's the clavicle, first rib. This is the apex of the lung. And so this is what in anatomical terms we call a thoracic inlet. Some even call it the thoracic outlet because some things move out from here. But this is the superior thoracic aperture. It's got this first rib, the clavicle, and the sternum, and the vertebra. And this is where the thorax sort of begins. And you can see the apex of the lungs. And you can see the trachea. We'll do this again in another session. We are doing the heart first. So this is one end of the thorax. Now I'm going to take you down to the other end of the thorax. So you see the lungs getting bigger, the heart showing up in the middle. And then when you keep going further inferiorly, you will see the diaphragm popping up. And here's the diaphragm that popped up. And now under the diaphragm, there'll be a liver. Diaphragm on that side. You keep going inferiorly, slowly the lungs also completely get absorbed, and here we are pretty much in the abdomen. Now this is abdominal stuff. You can see the kidney is going to pop up here. You see that's the kidney. So where do we begin with when we're doing the heart? And so there's several ways of doing this, but I'll start with the inferior most aspect on the diaphragm. So I'm moving back superiorly up into the thorax now in my views. And here you can see the liver and the diaphragm is going to show up, and then you see this little thing showing up over here. It's getting bigger. Now this is the apex of the heart because it's the most inferior aspect of the heart. And there's the apex of the heart. And as you can keep moving superiorly, you see it sort of developing. And here you can see a whole structure developing, and that is your heart. So you can clearly see a sort of chamber here, a wall here. And you can see a chamber on this side. And the same way you can see a wall and a chamber on that side. And this is your left ventricle. And that's your left ventricle wall. And this here is the right ventricle. And that's the right ventricular wall. And you can see how the right ventricle wall is thinner than the left ventricle wall. You can see how much thicker it is. And this is the interventricular septum. And you can see that here also. And this little dark gray, the light gray is blood, but this darker gray is actually papillary muscles. These are muscles that you will see attaching to the walls if you move them up and down. You can see them attaching to the wall. And if you kept moving slightly further superiorly, you will actually, it's hard to see, but this is where your mitral valve is. This is where your mitral valve is. And the tricuspid valve is sort of around the same area. It's hard to see the mitral and tricuspid valve unless you do a CT with radioactive dye in the blood, and you do that for many things. And there, the valve leaflets are much more visible, and these chambers are very bright. And the arteries and veins that we'll talk about are also very bright, but you can still see them in a normal CT. And so let's do that also. So this,
Sorry,
yes,
could you point out the wall of the right ventricle again?
yes. So if you come look here, this is the left ventricle, and this is the
Yep.
right ventricle.
And the wall?
Oh,
Is
this is
it
the
the
wall. Yeah,
left
yeah, yeah.
ventricle?
Yeah, that's quite thin. The right ventricle wall is
Oh,
actually not.
okay, right. So, yeah.
The left ventricle wall, you can actually see a fair amount of thickness there. And it's as thick as the interventricular septum, but the right ventricle wall is actually quite thin. So,
Right.
so that's the thin wall, and you can even see the pericardium. Unfortunately, I forgot to mention the pericardium in the checklist, and I noticed that yesterday, and I still didn't put it in. I forgot again. But that's the pericardium that you can see on the outside. The pericardium is better viewed. Actually, let me change the view, and in this view you'll see the pericardium better. And if you look at this view here, just further up a bit, you can see the pericardium right here, and you can actually follow the pericardium. You can see it slightly better in this view. But let's head back. Oh, where'd you take us? Go back up here. All right, here we are, and here's the heart, and those were the two ventricles. Now that is the right ventricle, that is the left ventricle, that is the right atrium, and that is the left atrium. The left atrium is the most posterior structure of the heart anatomically, and the right atrium is posterior but sort of lateral towards the right side. And this is the interatrial septum. You can see the septum between the two atria, and those around it, you can see the walls of the left and right atrium also. If you move slightly further around, you can sort of see the interventricular, atrioventricular sulci also. Let me move it slightly further up, and you'll see that's the atrioventricular sulcus. You can see that. And these are the major chambers of the heart. That's what you can see here. Any questions, let me know. And at the same time, let me check if I've missed anything. So I've got the left ventricle. We did the walls of the left ventricle. We did the interventricular septum. We did the right ventricle, the walls of the right ventricle, the left atrium, the walls of the left atrium, interatrial septum, right atrium, walls of the right atrium, mitral valve, papillary muscles, and tricuspid valve. So I think we've covered this. Got any questions, let me know. Okay, so now let's move on to the aorta and all the interesting structures there. Now, if you found the left ventricle, now if you move the left scroller superiorly, and you will notice the left ventricle up, not yet, in a little bit. Keep following it superiorly, and the left ventricle in this area will sort of pop into this round structure, and that is the root of the aorta. The aortic valve is exactly around this area. It can't be seen, but this is where the aortic valve would be. And as soon as you move superior to that, you get to the ascending aorta. So this is the aorta itself. We're going to do the branches of the aorta also, at least in this area. So I'll get to that in a little bit. But before that, let's just take this aorta, keep going more superiorly, keep going superiorly. And here, if you notice, the aorta sort of joins with another structure, but it doesn't really join. This is the arch of the aorta. This is the arch of the aorta that is going across. And then from this area, it actually is going inferiorly. And so the aorta now becomes the descending aorta. And if you look there, you've got the ascending aorta, and there you've got the descending aorta. So let's go back to the arch of the aorta. Oops, the other way, and here's the arch of the aorta. Now here's the arch of the aorta, and if I keep moving superiorly, let's keep moving superiorly, I will notice that the arch of the aorta forms a few vessels. There's one, there's another one, and there's another one. So these formed out of the arch of the aorta. And that is the brachiocephalic trunk. That is the left coronary artery, and that is the left subclavian artery. So brachiocephalic trunk, left coronary artery, left subclavian artery, and these are the major branches of the arch of the aorta. And if I keep going down the descending aorta, oops, I'm going up now. I'm going to put it down. Here, the descending aorta. Here's the descending aorta. And another thing, descending aorta gives off an intercostal artery on both sides at almost every level of the rib. They're usually visible, but they're not too obvious, but they're visible over here, and sometimes you can see them going on to the other side. And here is one intercostal artery, and if you kept going downwards, when the next rib sort of pops up, you'll see another opening for another intercostal artery over there. And so all these posterior intercostal arteries come out from the aorta on this side, and one goes the other way also. So it's a bit hard to see, but that is where they are. When the rib sort of develops, that is where they come. And on the rib, the intercostal arteries travel in the costal groove. So you can keep, that's how the costal groove is viewed. You can keep viewing it over there if to see that the intercostal structures are in that costal groove over there. All right. And let's go back up. And those were the major branches of the aorta. I may have missed some, so let's see if I did or I didn't. And so we looked for the aortic valve, left and right coronary artery. I didn't show you, I'll just show you that. Ascending aorta, brachiocephalic trunk, left carotid and subclavian, the artery aorta, descending aorta, and one left right intercostal artery and followed through the costal margin. So we did that. I forgot to show you the coronary arteries, which we will be doing in detail again right now, actually, when we go back to the coronary arteries, but let's do it now. So let's go back to the left ventricle. Remember, I showed this to you, the left ventricle. And from the left ventricle, we keep moving superiorly until the aorta pops up here, and there's the aorta. And if you keep looking at it, you see that vessel there? That is the left, that itself is the left coronary artery. Then of course it bifurcates into the circumflex and the left anterior descending. We'll do that in a second. That's the left coronary artery. And the right coronary artery is usually hard, it's a bit hard to see, but it's usually around this area. I believe that is the right coronary artery, but I can't tell clearly in this one. But in most CTs, it is fairly clear. It isn't in this one. And if you Googled it, you'd see it. But it is in this area, the right coronary artery, and it moves down in this atrioventricular sulcus right over there. So that's where the right coronary artery would be. The left coronary artery, as you can see, is very obvious, and usually is in these CTs. All right. Any questions? Are we all following? Yes.
Sorry, the SVC, is that the one directly adjacent to the aorta?
Yes, that is the superior vena cava. This one? Yep, that is. And don't you worry, if you look at the checklist, we will be doing the whole, we're going to be doing, after the coronary arteries, we will be doing the superior and inferior vena cava and all the veins also, so I will not miss that. But you're absolutely correct, that is the SVC over there. Okay, so let's do the coronary arteries, let's do the left coronary artery into its bifurcation, and the left anterior descending, and the circumflex, right coronary artery, and the posterior descending. Yes. So here we are, and I could show you the left coronary artery is right there. Now, left coronary artery, if you look at it, it bifurcates almost as quickly as it exits the cusp. And that is the left anterior descending. It's going in the interventricular groove here. And if you keep following it, that is the left anterior descending that continues downward all the way till over there. And we'll keep going further. Now it's sort of out of view. But that is the left, oops, going too far. That is the left anterior descending. And it branches out into a few here. On the other hand, if you keep looking here, there's another branch that comes out this way, and that is keep your eye here, you'll see it pop up. And that is the circumflex artery. There's the circumflex artery. And the circumflex artery goes around the atrioventricular sulcus, and it moves back posteriorly over there, and then it actually moves backward inside, and you sort of lose it from view over there. but that's your circumflex artery. So you can see the circumflex artery, and you can see the anterior descending artery very clearly on a CT scan. On the other side, then you have the right coronary artery, which I said that it's hard to see here, but that's where the right coronary artery is, and then it moves downward into the atrioventricular sulcus here, and it keeps going down posteriorly, and then the absolute posterior area, it moves into the atrioventricular sulcus, and here, really posteriorly down here at the bottom of the heart, you can sort of see it becoming, now this we can see here, we can see the posterior descending artery. So you saw that little artery there. It's a bit hard to see, but that one that I'm following, that's the posterior descending artery, or the posterior interventricular artery. Now, that is more visible on this particular CT scan, but the right coronary itself isn't. But the right coronary can be seen on a CT scan, almost not always as easily as the left coronary, but it's not too hard to see. All right, any questions about the coronary artery? Will you all be able to follow this?
Oh, yeah, I just had a question.
Yes.
Is it possible to see the coronary sinus?
It is possible to see the coronary sinus. I actually have it right here at the end. But now that you mentioned it, let's just actually wait for the coronary sinus, because it drains into the right atrium, and I'll show it to you when I do the veins. I won't miss the coronary sinus. Yeah, it is possible to see it, and I will show it to you. All right. Any other questions? Ronnie, did you have a question? Did somebody said something? Also, there were two people who spoke with Sam when Sam spoke.
It was not me.
Anyone else? All right, no, it wasn't right. Any other questions? Let me know. Okay, so that's done. What's next on the list? Okay, now we have to do the brachiocephalic trunk. Absolutely. So branches of the arch of the aorta. We did two of them, but we have to follow them. So now let's keep going up. That's the aorta. Let's keep following the aorta. Now that's the arch of the aorta. At the arch of the aorta, we saw three major branches. One is the brachiocephalic trunk. One is the left common carotid, and one is the left subclavian. So I'll start with the left common carotid first, because that's fairly the simplest at this point. And so let's follow this. This is the left common carotid. Let's follow this further up into the neck. You can see the lungs getting smaller. Let's keep following this into the neck, and you will notice that it has come into the neck until this point. That's the thyroid gland. We will do that in another session, but just to show you where we are in the neck. And I can't keep going further because I think it just moves on to the pelvis then, because that's the leg. There you go. So that is the internal carotid artery on the left side. So let's follow that again. You should find it should get you right to the arch of the aorta. So let's go back there. That is the left internal carotid artery, and there you go. It just joined the arch of the aorta. Did you see that? So that was your left common carotid artery. Next one, let's do the left subclavian artery. So the subclavian artery, as the name suggests, has to move under the clavicle. So first it moves up superiorly as the lung becomes smaller. And then if you keep following this, you will see that it sort of forms this structure here. That's the subclavian artery. And it crosses the clavicle, and then it moves into the axilla. So there is a subclavian artery. So that's what happened to this branch. If you can see, if you keep moving it upward, it will become the subclavian artery and cross over the apex of the lung from the clavicle and go into the arm. So that's the subclavian artery again. Moved it backward. Now the two interesting and important branches of the subclavian artery, apart from the fact that it becomes the axillary artery, but two important branches of the subclavian artery. One is the internal thoracic artery that moves anteriorly and descends down the anterior thoracic wall, and the other is the vertebral artery that goes up and moves in the vertebral transverse foramen of the vertebra. And so let's trace those and let's see if we can find those. And so look closely. It's a bit hard to see here, but that artery is the vertebral artery. And if I keep following it, it will find its way into, keep coming here, and you see it will find, you see that? It has found its way into the transverse foramen of the vertebra. Now that is hard to see, but what I can ask you to do is that if you can find a vertebra and just find the transverse foramen, and just find the vessel in there, which you can see it's one on both sides. Now let's find that vessel and let's trace it downward and see where does it vanish. And let's keep chasing that vessel. Let's keep chasing that vessel. It's going down there. It's going down there. Now there's an artery and a vein, and here it comes. Here it comes. That's the artery, and there you see it joined this structure. And this structure is the subclavian artery. And if you keep following that downwards, and you will see it will join the arch of the aorta. And there it goes, join the arch of the aorta. So let's do this again. Above, that's the subclavian, left subclavian artery. And around this area, it will give off a vertebral artery and become the subclavian. There's the vertebral artery. So subclavian artery will go inferiorly, but the vertebral artery will keep coming up and go into the vertebral foramen. So that's the vertebral artery. Now let's go back to the subclavian artery. Here we are. Where'd it go? There it is. There's the subclavian artery again. Now here the subclavian artery also gives off another branch, which is the internal thoracic artery. Now it evades me sometimes. Maybe it's that one. I think it is that one. Let's follow it. Let's follow it. Let's follow it. Yep, it is that one. And there you see it's become an artery, right? That's where the internal thoracic artery is. So that's the internal thoracic artery and vein. There's one on the other side also. They're just behind the sternum, laterally on each side. It's also used to be called the internal mammary artery. Now, this one, because it also evades me at times, what I do is that I always know it's there. I can follow it back. So let's follow it back. Let's follow that structure back. That is definitely the internal thoracic artery. And see where it joins. It's right there. And here it joins the subclavian artery. It joins this artery, and if I take that artery back down, it becomes the the arch of the aorta. So, any questions about those two structures, the left common carotid and the left subclavian, and the two major branches of the left subclavian, which is the internal thoracic and the vertebral artery? All good with that one? Okay, now let's do the other side for the same structure. Now again, we are here. Remember, these were three. There's a brachiocephalic trunk, left common carotid, left subclavian. So what does the brachiocephalic trunk become? It becomes a right common carotid in the right subclavian. So let's see, you follow it. We keep following it up, and here you can see it divide into two. So that's the left common carotid, that's the left subclavian. Let's follow the left common carotid and see how it just finds its way into the neck. And there it is, coming up into the neck. Oops, there you go. And then we follow that back, and this left common carotid will join with the subclavian and become the brachiocephalic trunk and into the arch of the aorta. So there you've got the left subclavian. Sorry, the left common carotid. This is the left subclavian. That's the left common carotid. Left subclavian, let's look at the artery itself. It becomes a subclavian artery, and from there it will go under the clavicle and into the arm. And now it will become an upper limb artery, and we will only do that if we are doing upper limb. But as we mentioned before, this subclavian will have to give off a vertebral artery, which is this one over here that I'm pointing and pulling up, and that will find its way into the transverse foramen here. And if you find it difficult to find it, just find the transverse foramen. That's not too hard to find. The transverse foramen in the C6 or even the C7 vertebra, it will still take you there. And you follow it inferiorly, and that structure should hit the subclavian artery, and it just did that right over there. And that is a vertebral artery. And the same thing for the internal thoracic. So let's go down and find the internal thoracic artery. That's the internal thoracic artery. Let's chase that up. Internal thoracic artery, following it up here. Keep following it. Keep following it. It crosses over to the apex. It keeps coming, it's coming, it hasn't joined that yet, and here it has just joined the subclavian artery. And that's the subclavian artery. If you follow it back, the subclavian again joins the common carotid and becomes a brachiocephalic trunk here, and the brachiocephalic trunk becomes the arch of the aorta there. So I think that is all that I had to show you with the branches of the arch of the aorta. Any questions? Sorry about that. Is everything clear? So we did the brachiocephalic trunk. We followed the brachiocephalic trunk to its bifurcation. Right common carotid artery and followed it to the neck. Right subclavian artery followed to the clavicle. Right vertebral artery followed to C6 transverse foramen. Right internal thoracic artery to the anterior thoracic wall. Left common carotid, and the same thing with the left subclavian, left vertebral, and left internal thoracic artery. So we're done with those. All right. Any questions before I move on to the pulmonary arteries? Okay, so let's go on to the pulmonary arteries now. So let's go back to the chambers of the heart. We went here, remember these chambers? So this was the left ventricle. This was the right ventricle. So let's chase the right ventricle this time. And in the right ventricle, let's move upwards. And the right ventricle will slowly become a structure itself. And see, it's forming the structure. And this structure, look, this is a perfect view for it. You see that? Now that is the pulmonary trunk, and that turns into the right and left pulmonary arteries. So we know what this was. This was the ascending aorta. This was the descending aorta. And now we can see the pulmonary trunk right next to it. And there is this space here that radiologists really like to talk about, and that is, you see the pulmonary trunk ending here, and as the pulmonary trunk ends, the arch of aorta begins. And the space between the arch of aorta and the pulmonary trunk, which is like the aortic pulmonic window, it's an area where recurrent laryngeal nerve comes through here, and the angle of Louis is here. So I thought I'd mention that also. I think I have it in the checklist also. So we saw the pulmonary trunk, we saw the left pulmonary artery, we saw the right pulmonary artery, and the aortic pulmonary window at the level of the sternal angle, or the angle of Louis. That is right there. Any questions so far, and or any confusions? All right, well, I guess we should still keep going. So next is the inferior vena cava. So inferior vena cava, we need to go back down to the thorax until we find the liver, and there's the liver. And the inferior vena cava, there's a lot to talk about in the abdomen for the IVC, but in the thorax, not much. As you move from the liver, now we're moving superiorly up, as you can see the bit of the lungs showing up. The IVC sort of kind of forms right here. You'll sort of see it pop up right here. There's the IVC. And the inferior vena cava sort of just forms and becomes as it crosses the diaphragm. That's the inferior vena cava there. It just joins the diaphragm and crosses the diaphragm and becomes part of the right atrium, and that's the inferior vena cava. So I'll show it you once again in the liver. The veins of the liver join, and there, that's the inferior vena cava, and as it crosses the diaphragm, it becomes part of the right atrium. Yep. And I think that covers the inferior vena cava and how it crosses the diaphragm and enters the right atrium, and the superior vena cava. And let's do the superior vena cava. Now, superior vena cava is on the other end, so let's move to the superior aspect of the heart. Now, we know this area, so this area we know pretty well. There's your pulmonary trunk, right and left pulmonary arteries, ascending aorta, descending aorta. Now, next to the ascending aorta is the superior vena cava. Oops, I can't believe I did that. Okay, that's the superior vena cava. And the superior vena cava, if you follow it inferiorly, it also just sort of fuses in with the right atrium. And there's the superior vena cava. Now, the major veins that form the superior vena cava we'll do in a second, but before that, we need to do the pulmonary veins. And the pulmonary veins, they drain into this chamber. Now, this is the left ventricle, this is the left atrium. So let's go a bit inferior. This is the left atrium, that's the right atrium, this is the left atrium. So as I move superiorly, see from the lungs, there's going to be a vein that's going to form and just move into the left atrium. There's one on this side. So that's the right pulmonary inferior, right inferior pulmonary vein. Let's keep moving up. And there you see that is the left inferior pulmonary vein. Let's keep moving up. And there forms a right superior pulmonary vein. It becomes slightly more clearer here. And the left superior pulmonary vein. The pulmonary veins are 2 on the left, 2 on the right. One is superior, one is inferior, and they drain into the left atrium, and those are your 4 pulmonary veins that are going through here. Okay. Any questions so far? All right. So let's keep going and go into the major veins. So we have to see the superior vena cava, the left and right brachiocephalic veins, the left subclavian vein, and the internal jugular vein, and the right and left brachiocephalic vein, internal jugular vein. And then we'll do the azygos and hemiazygos and coronae sinus. But let's do those. Similar to the brachiocephalic artery, the brachiocephalic veins that come from the neck and the subclavian vein. So there's your superior vena cava. And that is your ascending aorta. So let's follow the superior vena cava superiorly. Keep going. And you see, it sort of forms a structure here. Now, this is the left brachiocephalic vein coming in and joining the right brachiocephalic vein. So that's the right brachiocephalic vein. That's the left brachiocephalic vein. Now, if you remember, and if not, I'll remind you, the brachiocephalic veins are formed on each side by the merger of the internal jugular vein and the subclavian vein. So if I look at this, now this is the right brachiocephalic vein. If I keep going up, and I keep going up, I will notice that this vein will join with a vein coming from under the clavicle. Now, where did that go? Oh, it's right here. So this is this vein. See that? So that's the internal jugular vein. That's the brachiocephalic vein, and that is the subclavian vein over there. And if I keep following this superiorly, I keep going up, then I will notice that this vein, see that? Now, which vein is this? That's the jugular vein. Internal jugular vein. So that's your internal jugular vein. That's the common carotid artery. We've done that. That's the internal jugular vein. Let's go back and follow this. The internal jugular vein will keep going until the subclavian vein hits it from the side, and that's this area. So the subclavian vein has come and joined it, and once the subclavian vein comes and joins it, it becomes the brachiocephalic vein, and then the brachiocephalic vein will join with the brachiocephalic vein on the other side, which just happened here, and that becomes the superior vena cava, and then that drains into the right atrium. Right there. So let's do it from the other way. Now there's your superior vena cava. Let's move it forward. There's a brachiocephalic vein on the other side. So this is the left brachiocephalic vein. That was on the right. So this is the left brachiocephalic vein. Let's keep moving the left brachiocephalic vein here. Same thing is going to happen with this. They're going to see a merger from under the clavicle with the subclavian vein. So that's the subclavian vein merging into it. And as I keep moving it further superiorly, the brachiocephalic vein essentially becomes the internal jugular vein, which you can see here. And again, at the level of the thyroid, that's your internal jugular vein. That's your internal carotid artery. That's the internal jugular vein on the other side, internal carotid artery. That's the thyroid gland. That's the trachea. And so there's your internal jugular vein. Now, if you go the other way, let's take it down inferiorly. The internal jugular vein should join with the subclavian vein here, and you can see that joining. It forms a brachiocephalic vein. The brachiocephalic vein crosses to the other side, joins with the other brachiocephalic vein, and becomes a superior vena cava. And there you go. Any questions to that? Okay, so let's keep going further. And where was that document? There we are. And let's look at the azygos, hemiazygos, and the coronary sinus. Now, so what do we know so far? Okay, like this is a good place. Now you'll see a lot of cross sections that show this plane. And what do you see on this plane? You see the pulmonary trunk and the right and left pulmonary arteries. You see the ascending aorta, you see the descending aorta, and you see the superior vena cava. Now, again, here it's not too clear, but at this level, and if I keep looking at the superior vena cava, and it will join. Oh, am I missing it? Wait, slightly higher up, slightly there. You see that superior vena cava is joining something here, and that is actually the azygos vein. So if I keep going inferiorly, oops, I went superiorly. If I keep going inferiorly, that's the azygos vein. That's the azygos, and you can keep. In some CTs, it's actually quite more obvious, but that's where the azygos is. And the hemiazygos is on the other side, and it's stuck in this tissue here, and you can't really see it clearly. But the azygos and hemiazygos are next to each other like this. Don't confuse them for the aorta and the superior inferior vena cava. But that's the azygos, and I'll take it down to almost. It goes as far as the diaphragm, the azygos vein, and then it can cross the diaphragm even. But if you keep coming up superiorly, the azygos vein keeps coming up. You can see its venous tributaries also coming in, and the azygos comes up, keeps coming up. Where the hemiazygos and azygos meet, it's around this area, but you can't really see it here. But what you can see clearly is the azygos continuously going up and then merging with the superior vena cava right there. And that's how the azygos drains into the superior vena cava. And the only one thing that I had left to show you is the coronary sinus. Now, if you keep coming here, coronary sinus is it's fairly posterior. There it is. So it's coronary sinus is fairly posterior and towards this side, but it goes into the right atrium. And so you see that's the right atrium. This structure, as it forms, you'll see it form here. That's the coronary sinus. You see that? That's the coronary sinus. And that's the coronary sinus that drains all the veins of the heart, and then it itself drains into the right atrium. So that concludes this demonstration. And let me just check the checklist one more time. And yeah, I think so. That's done. And now I will stop the screen recording. Thank you for watching this video. Please subscribe to my YouTube channel and follow my Facebook page. Please also support my work on Patreon and Kickstarter. It will be greatly appreciated.